Hello and welcome to the special edition of the American Health Journal. I'm your host, Roger Cooper. Today our entire program focuses on what is for too many of us a never-ending quest, trying to lose weight. We know getting down to a proper weight is important because obesity can harm our health and even endanger our lives. Some have turned to gastric bypass surgery, which causes some food to bypass the stomach. But at the Morrow Institute in Rancho Mirage, more and more patients are choosing to go with a less invasive procedure called the lap-band. In this program, the physicians at the Morrow Institute and some patients about to have the procedure will tell us why they have chosen the lap-band and how it works. And we'll learn why the plastic and cosmetic surgeons at Morrow play such a vital role in getting good results once the weight comes off. We begin with the physician who founded the Morrow Institute, Dr. David Morrow.
I give a lot of thought to this. As the founder and head of the Morrow Institute, I kind of look for vision, for real meaning in the kinds of things that are done here, and endeavor to really help people accomplish what they want to do. And I think for so many decades, the problem of obesity has been really ignored and hasn't been dealt with the importance that it really deserves medically.
Dr. Morrow knows all too well that some seriously obese patients will die from their excess weight unless they do something. Dr. Christian Lazar, who happens to be a dentist, has arrived at the Morrow Institute as a patient. In just a few hours, he will undergo surgery to have a lap band put in place.
I hate to say it, a desperation move. I have everything else in my life that I could ever want. I got a successful practice, a wonderful fiance, I got house, cars, anything I want, but I couldn't lose 50 pounds to save my life.
But to save his life is exactly why Dr. Lazar says he is here today, preparing for the procedure.
This I look at as the way to do that. I want to do this while I am still healthy and I'm not going to be ravaged by the effects that this fat and this metabolic change is going to do on my body. I'm 40 right now. I'm just going to be probably having kids in the next couple of years. I don't want to be dead by the time my kids are in college or even worse.
It's a similar story for Terry Newenswander, who meets with the Morrow doctors in preparation for her lap-band surgery, which will also take place later today.
And I've had numerous people tell me, well, gosh, if it's just diet and exercise, why don't you do that now? And I said, well, it's not that simple. Most people would probably look at me and go, oh, you're not morbidly obese. Why are you doing this? And you're so healthy. In fact, my primary care physician tells me I'm the healthiest fat girl she knows. Cracks me up. But in all of that, as I'm healthy now, morbid obesity it just does horrific things to your body. And I'm avoiding diabetes. I'm avoiding all of those things by taking the journey, taking that path and moving down toward it. So I'm very excited about it, but it's not simple and it's not a quick fix. So I'm aware of that and ready for that.
My hat is off to those who finally make that major life-changing decision that they're going to take command of their own life, that they decide they no longer care to be heavy. They don't want to be visiting doctors and having surgery basically because of being heavy. And so my hat's off to them that they make a life-changing decision that they're going to take command of their own life.
So what is lap-band surgery? And how does it lead to weight loss? As Christian and Terry prep to go into surgery, let's talk with one of the Morrow surgeons who performs the procedure, Dr. Matthew Lublin. He tells us how the lap-band differs from gastric bypass.
The operation that we used to do a lot was the gastric bypass, which was a malabsorptive operation. It's a great operation. It works well. People lose a lot of weight, but there are more complications with it, and there's a little bit of a higher mortality risk with that operation. What those operations did was make a small stomach pouch in the stomach. So when that pouch filled with food, people would feel full and they would eat less so in that way they would eat less calories in, and they'd lose weight. Those operations worked, people lost weight, but actually the way they were done, after 2-3 years, the operations would not work anymore and people would gain all their weight back. So that brought us back to the lap band, or the laparoscopic adjustable gastric band. And the nice thing about this is, as it says, it's adjustable, where we put a band, which is made out of silicone. It's kind of like putting a belt around the top of the stomach. And in that belt is a balloon. And that balloon is hooked up to a little tube, which it connects to a port, which sits deep to your skin. And the nice thing about it is we can come to the office, and it takes about 5 minutes. We put a little needle into your skin, access the port, inject saline or salt water into that tubing, and that can inflate the balloon. And that's why it can be adjustable. So we can adjust this as much or as little as we want to get your desired weight loss. Laparoscopic, or you may have heard minimally invasive surgery. That's the incisions we use to do surgery now for a lap band. As you can see, they're small. Most of those are even smaller. They're probably about the size of a button on a shirt. And through those incisions, we can do surgery. Through one of those incisions, we put a camera, and through other incisions, we put instruments. So we're actually not looking directly into the belly, but we're actually looking on a TV screen when we do the surgery. So through those incisions, patients have less pain, quicker recovery, quicker return to activity, quicker return to work, and they can probably go home the day or the next day after surgery. How this operation works, it makes a small stomach pouch. When you eat, the pouch should dilate with food that will make you feel full, and you won't eat. And the food will slowly empty out of that pouch through that opening in the band, and you'll be ready for your next meal. Now, the bigger the opening in the band, the quicker the food is going to go out, and the quicker you're going to be hungry. So when we inject fluid or saline into that balloon, it dilates the balloon, makes a smaller opening. The food stays in the pouch longer, and in that way, you feel full much quicker, and the food takes longer to go out of the band, and you eat less. It's a very, very safe operation. And then we should talk about the weight loss numbers. Now, we have good data in the US now for about 5 years. And if you look at 5 years, we estimate that the excess body weight loss, which is how much weight over what your ideal weight should be, is about 65%. So if you say that somebody, for every 100 pounds overweight you are, you can expect to lose about 65 pounds. Any of these operations are only as successful as the long-term outcomes. Now, if people lost weight and gained it all back in 2-3 years, then this would not be a successful operation. And that's why when I say 5-year data, it's still 65%. So people have long-term, not just weight loss, but long-term weight maintenance as well at that level.